If you have traditional Medicare, from day 1 to day 20, they pay for your inpatient skilled nursing stay at 100%.
Yes.
From day 21 to day 100, they pay at 80%. So your coinsurance is 20%. For some reason, some patients they don't know this. So they may be in day 40 or day 50, and all of a sudden they get a visit from the business office and they don't understand why they have a bill.
Hello, this is Matt Helton, your reverse mortgage expert, and you found the Serving Senior podcast. We highlight those businesses and individuals that help seniors not just get by, not just survive, but thrive in retirement. And today we have another one of those awesome people. We have Miss Vivian Johnson. Now, Vivian is the founder of VJ Consulting Services, and she's going to share with you today how she uses that platform to serve seniors and help them have a great retirement. Vivian, how are you doing today?
I am good. How are you doing? And thank you for having me on your podcast.
Hey, you're so welcome. I'm so happy to have you here. When the first time I met you, I heard you talk and I saw that smile. I was like, all right, it's Vivian. We're going to have her on the show. She'd be perfect. So thank you for being here. How's your day going?
So far, so good.
Good to hear. Well, Vivian, we like to get to know the people because we found, just like in any type of business, you got to know people, then you got to like them, you got to trust them, even before you work with them, before you allow them to help the people you know and love. So please, if you could share some background, maybe who you are and where you're from, maybe some of the jobs you've had in the past, and a little bit of your journey to get here today would be awesome.
Okay. So I am a retired occupational therapy assistant.
Okay.
I was an occupational therapy assistant active for about 15 and a half years.
Got it.
And I retired my license for the state and the national level in good standings.
Okay.
So I've worked in many skilled nursing facilities here in Nashville.
Okay, nice.
And I've sat in on care plan meetings with families that loved ones are being admitted to the nursing home.
Okay, gosh. Where are you from? Where'd you grow up?
I grew up here in Nashville.
No way. I've been looking for you. You're like the last one, the last original Nashvilleian. Really? Where'd you go to high school?
I graduated from Hume-Fogg High School.
Hume-Fogg, okay.
In 1980, my major was vocational clerical.
Okay.
Then I went on to Nashville State Community College, and I completed the associate's degree program in occupational therapy assistant.
Okay.
And I graduated in 2007.
2007. I'm sure with honors. We'll just I'm sure it was. Okay. That's awesome. Where'd you do after that?
So I guess my first job was at Select Specialty Hospital.
Okay.
They dealt with a lot of ventilators. And then from there I went to mainly skilled nursing, Cumberland Manor. I've been to Nashville Center for Rehab. I've worked at NHC Cool Springs. I've worked at Bethany Nursing Home. I've worked at a lot of nursing homes here in Nashville. And I mainly want to show people how to navigate the skilled nursing process because it is a process. Okay. What happens is a patient has been in a hospital.
Okay.
There's an overnight stay of 3 days to be qualified to be admitted into a skilled nursing facility.
All right.
When I say skilled nursing, I mean a nursing home.
Got it.
The reason we call it skilled nursing is because you have qualified skilled people that have gone to school and we are trained to educate the patients. That's why we call it skilled nursing.
Okay.
Okay. So the biggest problem that I'm running into, I'm getting a lot of telephone calls after the fact, after people are being discharged from the nursing homes. They're calling me, they're saying, Vivian, I have a bill. I have a bill for $800. I have a bill for $600.
Okay.
I have a bill for $1,200. Tell me what happened. So what happens is, if you have, right now I'm only talking about traditional Medicare. That's all I'm talking about. That is the red, white, and blue insurance card. Okay? If you have traditional Medicare, from day 1 to day 20, they pay for your inpatient skilled nursing stay at 100%.
Yes.
From day 21 to day 100, they pay at 80%. So your coinsurance is 20%. For some reason, some patients they don't know this. So they may be in day 40 or day 50, and all of a sudden they get a visit from the business office and they don't understand why they have a bill.
Okay.
Okay. So one of the reasons that I started this business was because I want to educate families. I want to educate patients. I want them to be safe. I don't want them to fall. I don't want any loss of balance episodes at home. When you get into the nursing home, work with your therapist. Be safe. But the main thing is you want to know on day one, when you get there, how many days is your insurance company going to pay 100%? That's the first thing you want to ask when you go to your care plan meeting.
Got it.
Okay. The next question you want to ask is, what day does my copay kick in? And how much is my copayment? Okay. That's what you want to ask at a care plan meeting. Okay. A care plan meeting is normally held within the first week of a patient being admitted into a nursing home.
Okay.
So you've already used some of your days up. So if they tell you your coinsurance of 20% kicks in on day 21 and you're on day 27, you've got about 6 days with the coinsurance. That's how they are incurring bills, but they don't know. And it's not the nursing home's fault that they don't know. It's just that they have so many patients.
Right.
And if they come to see a patient to tell them about their coinsurance, well, they may be in therapy. They may be at a doctor's visit. So what happens is they don't get back to them to tell them about these bills until after they've incurred all these charges. Okay. And then the patients are upset. Wow. So what I tell families is when you go to that care plan meeting, you need 2 advocates for the patient. Okay. And they need to bring a pencil and they need to bring a paper and they need to write a lot of notes. Because once they tell you that your coinsurance is kicking in on day 21, I'm still talking about traditional Medicare, okay, to day 100. Then and then they'll tell you how much it is. You pretty much have an idea of how much your bill is going to be, so you can gauge how long you want to stay there or not.
Okay.
Does that make sense?
Mm-hmm.
Okay. So then the next thing you want to talk about is when they discharge to home, are they going to need a bed? Are they going to need oxygen? Mm. In that care plan meeting, therapy is there, nursing is there, activities is there, dietary is there. You've got all the disciplines there. Therapy needs to know that the patient will need a bed.
Okay.
Okay. The reason I say this is because it has to be in their daily note when they treat the patient for therapy. The insurance company, they will look at that note and that will determine if the patient qualifies for a bed or not. Huh? If that information is not in their daily note, the patient can still get a hospital bed, but it may be a delay in service. They may be discharged. Mm-hmm. So to prevent a delay in care or a delay in service, when you get to their care plan meeting, you need to let therapy know they need a bed to go home.
Gotcha.
If the patient needs oxygen, therapy also needs to know. It's because they need to monitor the patient's O2 saturations while they're doing therapy, during therapy, and then after therapy.
Makes sense.
Those need to be in the notes as well. The insurance company, they look at those numbers, and that determines if the patient is going to get oxygen when they go home. If those numbers are not in the notes, the patient can still get oxygen, but it just they may not get it when they discharge. But to prevent a delay in care, it's best that you bring all this stuff up at the care plan meeting.
That makes sense.
And that sense?
And then is this something that you can help with? Is that where you come into play, is going to that care plan meeting? Or do you do this more in advance, coaching the family, coaching the patient, or where do you come in to help?
I can coach the family. I can coach the patient. I can come to the care plan meeting. I can do a mock care plan meeting. It's basically up to the family, however they want to address it. It's, I'm leaving it up to them because this patient is thrown into an oblivion. Wow. They have left where they live and they're in a totally new environment with new people. You got people coming in and out of your room all times of the day, all times of the night. So they're nervous and they're upset. So what I try to do is keep it to the patient's level or the family's level of comfort to minimize the stress, because there's a high level of stress when you're going into a nursing home. So whatever avenue they need me, that's where I'll meet them.
That's fantastic. So it sounds like, if I was thinking through how to explain it, it's almost like they're in a new environment. Everyone's speaking a different language. It's almost like you're the translator, taking it from medical terms and stressed out medical terms, right? All the way to calm, understandable, everyday language. And you're kind of the translator that can help them put it all together, if that makes sense.
The word is liaison. I would be the liaison.
Yeah.
That's the word. Right.
Yeah.
So then another thing that needs to be addressed in the care plan meeting is where this patient is going when they leave here. The first thing they're going to ask you in the care plan meeting is, where is the patient going?
Okay.
Is the patient going to an assisted living facility? Are they going to stay at the facility long term? Are they going home independently? Or are they going home with the caregiver?
Got it.
Okay. They need to know this at the care plan meeting, because you got to start preparing for discharge as soon as the patient gets to the nursing home. Wow. The insurance company is not going to keep paying for you to stay there.
Got it.
And they'll pay, but you're going to have a big portion to pay too. And the longer you stay past the 20 days, then the more your bill is going to be. Wow. So it's best to get in there, see what your budget is, what you can afford, and to get the patient out of there without incurring a huge bill.
Okay.
Okay.
Yep.
So if they're going home with the caregiver needs to come to the facility and participate in therapy.
Got it.
So when they get the patient home, they'll know how to care for the patient.
Gotcha.
Because once the patient gets home, therapy's not going to be there with them. You're all on your own now.
Mm-hmm.
So you learn as much as you can learn. You take it home and you learn from it. So whatever happens, it doesn't happen again. The number one reason we get patients is because of a fall to the bathroom. That is our number one reason.
Okay. Wow.
Number one reason.
Wow.
So then another thing I tell them to address is, when you are first coming into the facility, I recommend that the family do the laundry.
Okay.
Because everybody's clothes are put all together, all the patients, and they're washed in one big machine. Mm. And people lose a lot of clothes. Wow. And it's hard. Sometimes they find them and sometimes they don't.
Okay.
So there's a sheet called an inventory sheet. When the patient first comes in, what you do is you fill out an inventory sheet. And every garment, every item that you bring in, you put the patient's name in a permanent marker, and you put the room number. And you also put that item on the inventory sheet. You give the facility a copy of the inventory sheet, you keep a copy, and take a picture of each item. If the facility cannot find that item and it's on the inventory list, most of the time they will reimburse you for it.
Nice.
So that's why I tell people to do an inventory sheet and take a picture.
Wow. Great tip. Yeah, it's so cool. Most people only do this hopefully once or twice in their lifetime, but you've done it so many times. You know all the tips and tricks. It's like you're their facility coach, helping them have a great experience. You're like they're not excited because they're not on vacation, but you're like their tour guide, right? That's kind of helping them plan ahead. So that's amazing. How did you maybe share with the audience? How did you come up with this idea? Like, did you know a long time ago that you wanted to do something like this, or was it a recent idea?
Therapy is my passion.
Okay.
I love training. I love educating people, and I love for people to be safe. And what I found is people do better if they're at home in a familiar environment.
Yeah.
So I love to educate. I love to learn, and I love to train.
Okay.
So I've been doing this off and on anyway. Since I've been retired, I've been getting a lot of calls. I give people adaptive equipment to use at home. I just help people wherever I can. So this is my passion. This is what I went to school to do. And I learned to do it very well. And I had great teachers.
Okay. Oh,
Okay.
that's awesome.
So let me get back to another piece that I think is very crucial that patients need to know this. Never refuse therapy.
Wow.
If you're going to refuse therapy, more than likely the insurance company is going to give you a cut notice. We call that no medical insurance coverage. So what that means is you go see a patient, they say, I don't feel like doing therapy, I don't want to do it. But they're not sick, they're not at a doctor's office visit or anything like that. They just don't want to do it. The insurance company, once they see that about twice, they're going to issue a cut notice. They're going to say this patient is no longer covered under insurance. So once they give a cut notice, if you're there, say like if they give a cut notice today on May the 16th and you're still there on May the 18th, then you have 2 days at private pay because you're no longer medically covered under your insurance policy. So private pay days are a lot more expensive than your contractual pay or what your insurance company has contracted with the nursing home with.
Wow.
So that's very important. That's a really important piece that people need to know. There's also another piece. You have got to make progress.
Okay.
If you don't make progress doing therapy, therapists have to send in a daily note to the insurance company so they know what you're doing. Okay. If you don't make progress, they can issue a cut notice.
Wow.
This patient is not making progress. If you're not going to make progress, they figure you might as well go home. You can go home and not make progress, but they're paying room and board. They're paying for therapy. They're paying for meals. They're paying for medication, and it is expensive.
Right.
And they're not going to continue to pay that if you're not making progress.
Got it.
Okay. So just say they say May the 16th, patient's not making any progress. Our last day to cover this patient is May the 17th. If you're there past the 17th, any day after the 17th, it's a private pay day. And when you get to the care plan meeting, you can ask them how much are your private pay days. They will tell you.
Okay.
It is very expensive.
You probably don't want them to tell you. You don't want to find out, right? Gets it very expensive.
It's best to know. I think being informed, I think it's good to be informed because you know if you're covered until May the 16th, then I'm covered under my insurance. But if I'm there until the 18th, I know I have 2 days where I'm not covered. At least I'll know what is expected of me financially. So I think people need to know.
Yep.
I think education is important.
Most definitely. That's fantastic. That's great. What, tell me, I guess, Vivian, what are some or maybe your qualities, I like to call them superpowers, that you have that allow you to do so well and excel in serving these seniors at such a high level?
I like working with splints, people that have had a lot of strokes.
Okay.
There's a technique that you have to use when you're working with splints. And I got a lot of patients that had a lot of stroke patients.
Okay.
And I like to educate. I like to train the patient on because there's an adaptive dressing technique you have to use after you've had a stroke because one side is affected. So I just have to show them how to dress. I have to show them how to bathe. I have to show them how to eat. There's certain equipment we use that we have to order for them because one side of their body is affected, so they can't use that side anymore. Wow. So I enjoy teaching them. And I work with speech a lot. When I work with stroke patients, especially with self-feeding, I have to work with speech.
Okay.
Because their diet, sometimes they're on thin liquids, sometimes they're mechanical soft, and there's certain things that they can't eat. And so I have to make sure they're eating the right thing and using get the right utensil and the right cup. That's why they're also adhering to their diet that speech has given them.
Well-rounded. You have from all different levels. That's so cool. Well, Vivian, before we wrap up, wanted to make sure to tell the folks what parts of the country you service, and then if people wanted to learn more about you and how they get in touch with you, to have you help their family members or help them personally?
Okay. So I serve Williamson and Davidson counties.
Okay.
And I do have a business card. I don't know if they can see it. I'll just give them my phone number.
Perfect.
My phone number is 615-853-0887. You can call me at that number, or you can email me at the0774-770@gmail.com. And I'll be glad to go into more details because there's a lot of more information that needs to be discussed when you're going into a nursing home, but it doesn't have to be as stressful. You just have to know people that can help you navigate the process. And I do have a binder that I when I contract with the families, that I give the families, but consultation is free.
Nice.
Okay.
That's great. That is awesome. Well, Vivian, I'm really excited to get this message out there because you hear it so often where someone goes to the doctor, they go there, and then either one, they get the wrong advice, or number two is they maybe got the advice, but they were either the patient was so sick or the family was so stressed out, it made it right over their head. And to have someone that's a professional, to have someone that's trained, someone that's been in this conversations hundreds of times, listening is priceless. So I'm so glad that you do this, and so glad that you're helping these seniors this way.
Thank you. And thank you again for having me on your podcast.
You're so welcome. Well, so anything I should have asked you that I didn't ask you?
I think you've covered everything. I thank you for doing reverse mortgages because that's really important for seniors as well.
Thank you for saying that. Yep. You mentioned a couple times about bills and owing different things. So the unique thing about what we do is we just help them. Most seniors, either their first or second largest asset is their home. But unfortunately, unless they know what they're doing or understand how it works, it's an asset that's illiquid. Illiquid meaning you can't buy anything with it. And just like you're talking about, you can't pay any medical bills with it. So all we do is show seniors how to use a small percentage of their home equity to make it liquid, where that way they could pay medical bills. Or if things are going good, they can go on vacation, they can spoil the grandkids and still have equity left. If something happens to them, they still give the home to the family. They can still sell the house. They still own the house. It's just a unique tool that no one understands. So that's what we do, is educate people on how it works.
All right. Well, thank you. And I think that's a great work, and it's well needed. We have had patients that have had reverse mortgages.
Yeah.
And the business office has come in and asked them. We had one patient, they said, "What did you do with the $17,000 that the reverse mortgage company gave you?" And the patient, she said, "I spent it."
That's awesome. You got to get it. You got to get it out of your account before the nursing home wants it, right?
That's right. And she spent it.
That's awesome. That is awesome. Well, thank you so much again for your heart for service, and thank you for all you're doing out there.
Thank you, and you have a good day.
Thank you. And thank you for watching the Serving Senior podcast. Please be sure to subscribe. Please be sure to share it with your friends and family, and we'll see you on the next episode. Thanks again. Have a great day. See you, Vivian.
Thank you. Bye.
Bye now. Hey, this is Matt Helton with OneTrust Home Loans, home of Retirement Mortgage Solutions. And we really do appreciate you checking out the Serving Seniors podcast today. Now, please go to the description down in the body of the podcast where you can subscribe to get future shows. Please click that notification button so you get notified when other shows drop. And also, if you can go to servingseniourspodcast.com, and we'd love to hear a comment about our show. We have a heart to serve seniors, and we have a heart to make sure seniors don't just survive retirement, don't just get by in retirement. We want to show seniors how to thrive in retirement. So if you know of anyone that's 55 and older that could use some extra cash flow, maybe the retirement's not going the way that they like, our retirement mortgage solutions are designed for folks, and depending on the state, they're either 55 or 62 and older, to make sure that they have that kind of retirement that they want
as long as they own a home and they're in a good equity position, there could be some solutions that they may not have thought about, or maybe they've thought of and they just didn't know how they work. That's what we do. So anyone in that age group that could use some mortgage advice, my team and I would love to be able to help them. Thanks again, and look forward to seeing you on the next show. Have a great day.